My name is Enrico Ascher. I am the Vice Chair of the VEITHsymposium. I'm honored to have Dr. Juan Parodi today with us, our guest. He revolutionized vascular surgery, and I believe that he actually saved our specialty with the endovascular repair of aortic aneurysms. So I am honored and I'm ecstatic to have him here, not to talk about aneurysms, but rather to talk about the treatment of claudication. So Dr. Parodi, thank you for being here with us. And tell us a little bit about this new treatment that you are promulgating, and it seems very exciting, and it appears that it's working. Tell us about it.
It is. Thank you, Enrico, for inviting me. I'm very happy to be here. As you know, claudication is a very common condition in elderly people. About 20% of the people over 60, they have occlusions of the arteries. As we learned, the stenosis and the plaque formation doesn't start from the common carotid or from the coronary. They start from the common femoral. So if you take patients over 60, you will find that about 1 every 5, they have occlusion of the lower extremity. And why the lower extremities? We are hypertensive from the lower extremities. And we remember that very well when we were doing the aorta bifemoral bypasses. The aorta was very sick, but the femora was protected. And the more occlusion we had in the aorta, the less sickness we had in the femorals. And the only difference was the pressure. And we had a couple of patients that we made observations. We had 2 patients. Second patient, the director of the hospital, in a few days, he was calling us. You listen, this patient had 6 operations because of occluded popliteal aneurysm. Everything is occluded. You know, he's having rest pain. He doesn't want to have more bypasses or more stents or nothing. Just do an amputation. And my partner say, no way, you're gonna give water. And he took this patient and he gave 3 liters of water and 3 egg whites, because I thought if we can increase the oncotic pressure, we can keep more blood inside the vessel and we will have better perfusion. So we asked our internists to study 100 consecutive patients over 60 and keeping records of how much water they were taking every day, including in the food. So the conclusion was, no question, this is dehydration. So let's do a trial treating dehydration. And we were giving these patients 2.5 liters. We were giving albumin, giving water and increasing the oncotic pressure. We elevated the albumin to more than 4 grams per deciliter. And we were measuring cardiac output, volume, etc. And we learned that we were doing our job. So we did 132 patients until a few months ago. Now we completed 150. And in addition, we gave them 3.5 grams of salt every day. After 6 weeks, we repeated all the studies. And we sent all the information to a statistician that was independent. After 6 months, we did the same. We couldn't believe it. We couldn't believe it. You know, the second patient who was ready for an amputation, in 4 months, he sent us a picture from our wine country in the West. This is, today I walked 4 kilometers, and this is my therapy, a bottle of water. 4 kilometers, and he was ready for an amputation.
That's amazing.
The lady.
So I don't want to interrupt you, but so basically the treatment that you're recommending at this time for patients who have symptoms of claudication or rest pain even, you said, is 3 liters of fluid.
A little less, yeah.
Fluid. 2.5 or 3?
2.5.
2.5 liters of fluid, 3 egg whites a day, and 3.5 grams of salt. And
yeah,
basically that is the, and for how long they should be taking this?
Every day. That's what everybody should take. because obviously the albumin is absorbed as amino acid, The liver produces albumin, about 20 grams a day. The half-life of the albumin is very short, 21 days. Mm-hmm. So we need to keep giving albumin.
One thing you told me once, a few months ago, is that an important aspect of it, of drinking that much water, is that they shouldn't drink it cold water. They should be drinking warm water. Is that correct?
Yeah, we realized that if you ask them to drink cold water, they drink less.
Okay.
Because natural water, temperature water, we prefer that, yeah.
So you're improving the effective intravascular volume.
Right.
The real effective intravascular volume,
Absolutely.
that's the key thing of this treatment. And for that you need some proteins and fluid.
You know, Enrico, that is the normal treatment, is what you should take, I should take.
Right.
2 liters a day.
Excellent advice. And with this, I want to thank Dr. Parodi for being here with us at the VEITHsymposium, for bringing something which I believe will have a tremendous impact on the way we take care of our patients. And it makes a lot of sense. It just makes sense that this is the way to go, is to become normal again, have an effective intravascular volume, have proteins in your blood, and you'll be able to function better. So Dr. Parodi, thank you very much for this major contribution and for being here with us. Thank you.
Thank you.